Hello and welcome everyone in another episode of Researcher Celebrity powered by Empowering Science Foundation. Today we have Dr. Anuj Kedawat, and unlike most of our Researcher Celebrity conversation with a PhD degree, he is MBBS degree. So a brief introduction of Anuj. Dr. Anuj has done his MBBS from SawaiMan Hospital, Jaipur, Rajasthan, and currently is pursuing his master's education and is a resident in general surgery at SawaiMan Hospital also. With this brief introduction, I would like to welcome Dr. Anuj at the platform and say thank you from Empowering Science Foundation to take time out.
Thank you. Thank you. The pleasure is all mine.
So we always start our conversation that how and when you decided that you want to become a researcher.
When I was in an undergraduate first year, my senior pushed me towards ICMR. It is Indian College of Medical Research. It's basically it is basically a organization in India that gives you scholarship for a research paper that you've published. I interacted with my biochemistry HOD during that period, and what I liked the most about that was the interaction part. My research paper never got selected, it never got published, but the most important thing that I liked about it was the interaction part. None of my batchmates had that in their during the tenure of their course. They didn't have the interaction part, and that's what I liked about it: the interaction with patients, the interaction with teachers, the interaction with studying, as well as thinking that the studies will go somewhere
Okay,
for the
great.
betterment.
Nice. So I'll ask this that the whatever the research interaction you had made you
Yeah.
intrigued enough to pursue or start thinking about having a researcher component to your degree, because in
Yes.
India most of the doctors after having their MBBS or masters, the traditional route is to go and do practice, serve the community.
Yeah.
What
Yes,
brings
but
you
I
to the
think
researcher?
this is changing. My mom is also a doctor. She practices in vitro fertilization too. She has just started. She's 60, but she has just started doing IVF procedures. And I think in India the success rate is not as much because it's only 33% successful even in US. So what matters is how you orient your practice towards the results that are more promising, how you change your practice. And I think that's a part of research as well. You're not publishing as much as you are, but we'll definitely get there someday.
Absolutely. This is very important part because in research we always say that observation is the key. And the second is the orientation that how so you made an observation that now how you can connect those dots between and become any information into a knowledge. That is what plays a very crucial role for any other researcher. So let's start with this. When you were doing your 12th standard, okay, preparing
Yes.
for entrance exams for MBBS, as everyone does.
Yeah.
Most of the biology folks, like 99% of them in India,
Yeah.
once they select the biology as their major in 11th, they want to become a doctor. Okay.
Yeah.
So you achieved it, excelled the exams, did your degree. Then after MBBS, what was the first thought that you think that you have to pursue a master's, but not start practicing after MBBS?
The first thought was that I'm currently unemployed and I need to get a job.
Mm-hmm.
And with the job, I think as soon as I landed the job, within 6 months, I was in Scotland
Mm-hmm.
presenting my first paper.
Mm-hmm.
But the organization in Scotland changed it to a research video. So I presented my video there within the first 6 months of getting my job. So I think somewhere I am routing myself towards to be a more clinically oriented doctor. I think that will help me in my practice as well.
Okay. So how you see that things has been changed over the past decades, especially after COVID, that the doctors are now more interested, the clinical doctors, because so now here we have to use this specification most often because in researcher celebrities, mostly the people with the PhDs, either doctors or
Yeah.
like either clinical clinicians or not, but because we had one of our researcher celebrity very recently who has done his dental like education in dental surgery and all, and then after masters also did a PhD in that. So now we are seeing this change in Indian context where doctors either from the dental or the from clinical side, they are also considering PhD as an option. So according to your thoughts or your experiences and your vision now, because you want to do both hand in hand, that what are the factors which are responsible for this change in India?
In India, what I think that degrees are too overrated here. Like I did my master's and my undergraduate that was entirely sponsored by the state. I didn't spend a single you what do you say like my entire fees throughout my undergraduate course for the course of 5.5 years was like around I think $1,000 would be a too much higher price for the 5.5 years. So it was like $50 per year. An entire thing was sponsored by the state. And if I had money, you could get a similar degree in other college that's not sponsored by the government. So I think people in India can get their degrees very easily, like PhD, he can do it very easily, but it's not like we do it in US. It's not similar. Like in US, you have to follow steps. You have to be a junior. You have to be get acquainted with your seniors. In India, you can buy your degrees. I think not buy your degrees actually, but you can find a loophole to get the degree and get a better paying job in the end. So what I want to say is that in India, like institute like AIMS and my college are actually having raw data so in such a high amount of quantity that people are not utilizing the data. They're just going after the jobs. And this context is changing in the recent times. Like the government is forcing us to do research. Like they are giving scholarships. Like I told you in my undergraduate days, I got a opportunity, not a scholarship. I didn't get a scholarship. I got an opportunity to present my paper. Even today in my residency, there's a competition that who presents the best or who publishes the best research and paper. So I think the government has changed from that time over the course of 50 years in the past. Like my mom did it 30 years ago. So over the course of time, our government has changed and it has started encouraging people to post their research, to publish it, to go to conferences, to go abroad and see what other people are doing.
Oh, great. So,
I
yeah, yes, please continue, Anuj.
Most of this I got to know during COVID when almost every alternate week AIMS was presenting a paper that you have to treat COVID like this, you have to treat it like this. They were changing the guidelines, moderate, severe, and everything was changing. And that's when I knew that India is progressing.
Absolutely. So, this is for all the audience abroad, like outside the India, who are listening to this conversation, that having a medical degree is a task by itself. Like starting from making to the examinations, even in India and abroad everywhere. But the opportunities here in India, the support government of India provides and extends even after beyond the selection, as Dr. Anuj mentioned, is very important. And we should always consider as a researcher, generation of data is a big part of researcher's life. But when it comes about making the information out of it, sharing your findings with the rest of the world is the next step. And Dr. Anuj also mentioned about how government of India is trying to motivate more new doctors or doctors in general so that they can publish their findings in peer-reviewed journal, present their findings in national and international platforms. This is a good start for the young doctors so that they can start thinking of it. And because of what we have Dr. Anuj as our researcher celebrity today to share the insights about it, to share the passion that how they get motivated to do this. So now if I will start with the opportunity part, Dr. Anuj, what you can share with the students who are preparing for their medicals now, okay? That what are the different
Yeah.
opportunities they can consider for doing their MBBS or for, and then in the next step, I would like to know your thoughts about the students who are completing their MBBS and are considering research as their next move.
If a student in India is considering research as a next move, it's actually hard for a person to be associated with medical research. You have to have a job. I think you cannot just go to a medical college and ask them for data. You have to have, at least you have to have a contact. Like for a single research for a 1 month or so, you can go. But in the end, if you want to do some long term research that is substantial, you have to have a job there, or you have to have association in some sort of way to that college. Like some of the big institutions in India, they're offering that association. In my state, it's not so. I don't think my college offers such kind of association, but my college is definitely offering the resources. Like Americans have to buy up to date application. I have it free of cost, and that's an American application for latest treatments and latest guidelines. Whatever the latest research is regarding a particular disease, it's printing that sort of information, and I have that for free. So I think opportunities right now in my state, I have to create it myself. But overall in India, the big institutions are offering it.
Okay, great. So if we talk about the research, like obviously you have not done a lot of research till now, but when you see your peers doing research and utilizing the data which is available there for either it is for better practicing, helping the patients, what is the biggest motivation which takes you, which makes you feel interested in performing research?
The biggest motivation is my name written on a research paper. But actually, there are a lot of contradictions in treatments, like a simple procedure like incision and drainage. There is no specific guidelines how to do it, and that's what research paper helps us. Like a particular series of patients were treated this way, and the outcome was favorable. I think the research paper is that's where it's very helpful, and that's what I want to do in my life. Like I want to make a particular set of guidelines for a particular disease so that even a layman or a surgeon who's a beginner can do it with ease after reading it.
Absolutely. Developing the methodologies is one of the important part, but as I see, the motivation is the publication, which is a big
Not exactly a
debate.
publication, but yet as of yet, I've not published anything. So actually, that's a big motivation right now.
Yeah, because
My
then
friends have done it.
at the end of your masters, I think there will be a thesis which you have to publish a research paper for.
It's not that
Mandatory.
mandatory in my
Okay.
state. It's not
Okay.
that mandatory. Yeah, it helps that you have a research paper publication, but I don't think it's a prerequisite that you have to have it for passing the exams. It's not.
Okay. Okay. But the motivation which you have, and we can see the zeal in you that you will publish it one day for sure. But
Definitely, I'm just now collecting data for gallbladder cancers in Southeast Asia.
uh-huh.
It's very prevalent in North India, so I'm collecting the data regarding it. But collecting data in my college, it's like collecting water from ocean.
Okay.
It's just so vast. Like we
Mhm.
have 10,000 patients per
Oh.
year, and it's very, 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 very vast.
So this is the next question, which now I will ask about the patient management. When you have over like how you design a study for as a researcher, because you have to have a research question first, based on which you will uh, design and develop your methodology, and then screening all of that part. If you can walk us through uh, with your study, if it is possible.
I'm right now just starting to
Okay.
collect the data.
Mhm.
So I've not yet decided the study design, but it will be a retrospective study definitely because I'm collecting old files from hospital, but I'm not sure how will it turn out as
Okay.
of yet.
So now let's talk about uh, the future of the research, because mostly here what we are discussing is how you envision yourself in a longer run as a researcher, and as a clinician, how will you utilize the research done globally, because with this technology now everything is available. As you mentioned, you have so much of data, you want to develop those methodologies which even a beginner surgeon can, perform
Yeah,
or reproduce
in
the
the long
data which
run.
you have generated. So
Yeah.
how do you see that like when you are following someone else's research for your purposes, either it is developing for methodologies or performing
Yeah.
procedures?
I don't know how to answer that, but we basically select a pilot study, just like I did for my thesis. I selected a pilot study, and just I'm following the same methodology that as they have followed, because I'm a beginner here.
Mm-hmm.
So, and there's a lot of considerations in our college. Like I have to get it approved from ethics committee, and there's so many committees. So as of now, I've just taken a pilot study and I've replicated the methods they have followed.
Mm-hmm. So
Maybe when I'm old enough to develop my own, I'll do something.
yeah, so you have just probably seen the tip of the iceberg when we say about research,
Yeah, yeah,
because people talk about, the pressure it brings, the time it consumes, and the efforts it
yes,
takes. So if you have any experience of not failed experiments, but not the way, like, so when you are collecting the data, because as you said that you are in the beginning stage, everything might look very, rosy as a picture, but
yeah,
when you get deep dive into it, that's when you realize that how difficult it can be. But a researcher
yes.
always come up with the solutions and overcome all the hurdles which come in their path. So have you encountered any of such hurdle yet?
Actually, the most difficult part of my selection process was what to research about. The topics are so vast. The people that have already presented are like geniuses in their field, and how can I start by presenting something like incidence of gallbladder cancers or prevalence of it, or how the different outcomes of treatment have we decided on our patients who came in different stages of metastasis. And it was so difficult to decide on what point I want to focus, whether it's the incidence, whether it's prevalence. And it was just like I said, trying to select, trying to catch water from the ocean. It's very vast. And um, the most difficult part was to select which disease to focus on, which part of the disease, whether I want to focus on the results, the surgeries, what I want to do. That was the most difficult part, because in as a clinical surgeon, it's very difficult to focus just on one disease, because at any point of time, I have to deal with trauma, I have to deal with my duties, and it's like one moment I'm focusing on the appendix, and the next it's gallbladder. So it's very
So
difficult to
this
decide.
So this is what we always talk when you are actively performing the research. The time management is one of the issues that you have to generate data, then you have to publish, and then you have to write your thesis and whatnot, all of this, and you have to do perform all the experiments. But when we talk about the clinicians, as you mentioned, that you have to take care of OPDs, emergencies,
Yeah,
your duties, and then you have still have to formulate your data, compile it, and then analyze it, and then write the manuscript, which is too much to do for most of the doctors. And that's why we see in India that not many of the doctors are interested in performing any kind of research, because they have too much on their table just for their practices. So we'll say that you are courageous, and we appreciate your courage for undertaking or thinking to
yeah. But
take
I
this
think
research.
the times are changing. The doctors you are describing are from a generation above me.
Mm-hmm.
they were they were not having a home, they wanted to settle in their life. But
Mm-hmm.
most of the people or students in my generation are already settled, they have a home, they don't have to build a home from start.
Mm-hmm.
Like I think you are an immigrant, you had to build a home in America,
Mm-hmm.
so that must have been difficult. But I, living in India, I already have a home, I don't have to earn that much money
Mm-hmm.
to secure my future. So I think our generation will be more driven and more focused on research.
Nice,
That's I'm
nice.
sure.
That is very important part also, and I see that this is very important for any country when we talk about their clinicians to be performing or undertaking research, because so many things are yet to understand about human, about their diseases, about the epidemiology of most of the diseases, because in India, vector-borne disease is such a big, like apart from all the epidemiological studies, there are so much about vectors also, which is a big part of
Yeah,
studies, which I
it's a
believe
funny
is.
thing you talked about vectors. We have so many mosquitoes in India. I recently went to Bali, and they were talking me about buying Odomos for the mosquitoes. I was like, there are less mosquitoes in Bali than I have at my own house.
Mm-hmm. Yeah, so these are the things. Like I remember one of the conversation with our researcher celebrity who was also a clinician, that when they started talking about mosquitoes, and that is the thing which, not most of the doctors, because they do talk about the fevers, about the dengues, about the malarias based on their symptoms that they can do, but when it comes to the vectors, I was very surprised to see that a doctor is actually talking about the mosquitoes, about the different species of mosquitoes. They are spreading these different infections. And as you mentioned, yes, this is correct that now we see that shift where the young generations of clinicians are very open to perform research which are relevant in their field, obviously, and also as some of them are making the research as taking undertaking the positions of professors, associate professors, deans, and are more focused not in administration or the surgeries, but in the research, because they want to cultivate this concept of research in their medical hospitals, where they are motivating the next generation to undertake those questions which are still unanswered, that why a different set of patients behaving to a drug or react like responding to a drug other than the other ones. And I think that is something which you chose to work on also.
Not exactly. I'm a surgeon, so pharmaceutical is a part of my career, but I don't think I'll go into that. I'm more towards the surgical aspect, not towards the drug side.
Mm-hmm.
Uh, but what you said is true. The more hospitals that are opening in India are always opening with a research center in their name. My mother, she's also doing so many procedures, and this month I was doing some work with her, and I was like, why are you not recording it? Why not presenting it? Why you not? And I was like, if you're not going to present it, I am going to record and present that, because it's very it's changing work. Like we have all the machines that America has. We have imported so many machines for in vitro fertilization, and I'm like, you should record it and present it at international level, because it's research only. Because actually the outcomes are not that good, and when the outcomes are not that good, if we want to improve the outcomes, we have to do research. So
Absolutely. So this is one thing which we always say, that every single experiment performed and not published is like you are making your experiments blind to the world, because
so true.
nobody knows that you have done that. When you publish
Yeah.
it, that's when the rest of the world understands that, okay, this has been done. Because this is another part of research now, when we talk about research beyond the boundaries, that a problem, if somebody, so if, while you are going through a publication, following a procedure which somebody in the different part of the world has done, and then you are facing those same challenges, sometimes you get the answer, sometimes you gives the answer to your audience, that when they are reading your published research, that what you have done and then how you overcome the problem which they are facing. This is one big part
Yes.
of it. The second
Yes,
part
and
which
that's
now,
what I'm more
yes.
excited about.
Mhm.
That's the one that motivates me.
Yes. And now I would like to know that the impact of that, as your mother is in the profession, that how she motivated you to join a medical field and then become a clinician and then a researcher.
My mom is a very famous doctor in my city. So basically, I think she has done more than 2 lakh deliveries and cesarean sections. So everywhere I used to go, everybody used to recognize her. Like, you gave me my son, you gave me my daughter. So that's what motivated me. Like, even today, we went to buy vegetables, and someone said, "Ma'am, why are you coming to get the vegetables? You can ask someone else for you. Like, you can even arrange it on the call." And I'm like, everybody knows her.
Yeah, so this
So,
is like what makes you feel content and recognized, because recognition is one of the things which is there for doctors, like clinicians, but not for the researchers like PhDs and the people who are
yes,
doing active research. And that was the reason why when Empowering Science Foundation was found, we had this vision to break the barrier. And one of the barrier is recognizing researchers. People recognize, so many, like most of the active researchers know who got the Nobel Prize in their field at
Yeah.
least, but they don't
Yes.
know that how many peoples were responsible or at least contributed towards that piece. And at
Yeah.
Researcher Celebrity, we came up with this idea of celebrating research. And that's how we always say Researcher Celebrity. But when we read it, for us, it is let's celebrate research. And every single person who's doing research is a researcher celebrity for us. In this, in these conversations, we always have researchers from around the world sharing their journey, their thoughts, and their experiences, which are responsible for helping, motivating, and inspiring the other researchers around the world. And as you mentioned about your motivation from your mother, how she performed so many procedures, and also at this age, she's trying to do some research. That's when you come into picture and you're like, okay, if you will not publish it, I'll
Yeah.
record it and share with the world, because that is
Yes.
very important part of research. Your findings
Yes.
has to get and when we say about publication, that is one kind of recognition which you receives. But what is more fulfilling as a researcher is when your mother, like when you said the recognition you get in your city, you actually,
Yeah.
when you start publishing, you get the same recognition worldwide. When you move to another country,
Yes.
when you are presenting your data, you have published paper, then people will come and approach you by just by seeing your name that, okay, Dr. Anuj is here. He has published this
Yeah, I read
paper.
your paper. Yeah.
Somebody has, and then that's how I'm sure that you have approached some of them that, oh, I have read your
Yes.
paper on this thing.
Yes.
It was very motivating and inspiring.
Yeah.
So, how you see that the things when you are approaching to a doctor, to a researcher, to a surgeon outside India, when you are approaching with, either a question or for their expertise, how that response happens in there.
Um, I can tell you an example. I approached someone, like I mentioned, 6 months ago, I was in Scotland. I was presenting a video on laparoscopic nascent fundoplication in Edinburgh, the Royal College of Surgeons. Um, the only I had planned in my mind like I had to approach some people, so I research about them. I read their papers, but I think it was not successful. I was not able to approach them by their research papers, but rather I was just listening to their conversation and I joined in that I'm excited about this. I want to do this. Like I read some. I saw someone present a video about what do you call it, thoracotomy. He was a general surgeon. I was like, oh my god. In my college, I cannot do thoracotomy with my degree, but
Mhm,
someone else is doing it in their college, and it's very great. So that's how I approach people.
mhm,
I approached one more person after I read his paper. So one was with paper, one was with just live conversation. So
mhm.
actually, people who do research are very encouraging to young people. I feel
Yes,
that way. In India, with the older generation, they had to build their homes, as I said, and I don't think I have found a guide or mentor yet for my research, but people are actually trying, and I'm also trying that. One day, maybe I'll find someone who will guide me better. Right now, I'll just make do with what I have. So
absolutely. No, that is very important part. And this is for all the audience who are researchers, that whenever you are planning to join or attend any scientific conference or meeting nationally or internationally, first thing I will say that how you should approach a meeting is see their pamphlet, their agenda, the speakers they have, either the keynote speakers or their sessions, walk through it. See how many of the talks you are interested in. What are the researchers you really want to have an interaction based on your field of interest? Write it to them well ahead of that meeting. Try to get some time slot from them so that you can discuss your ideas, seek the guidance if you want the guidance from them. If you have a research question, share with them the ideas you have, because that's when these are the perfect places where you might meet your prospective mentor, advisor, future boss, because
Yeah,
these
future boss.
conversations,
Yes.
yes,
Yes.
so these conversations are very important if you prepare yourself for them. As Dr. Anuj mentioned, this is also one way that you end up there unprepared and you start interacting, because obviously that's why in-person meetings are there, that you just attend their talks, listen to that, and then based on your mutual overlap of the research, you start having the conversation. That is one way. But this is more robust, that if you already know who will the speakers will be, what they are talking about, because at the later stages, any given professor is working with more than 3, 4 different research questions. So what they are presenting at that meeting might not be of your interest, but you know the background of the researcher, their focus of their research group. So you know that even if they are not presenting this, you have this overlap where you can discuss and get guidance if you're looking for, or if you're looking for a job. As Dr. Anuj mentioned, a job is also one of the very important part, because you have a family to feed, you have your dreams, either it is traveling to the world or whatnot, all whatever you have, you need money for everything. So coming to that part, Anuj, when now based on this conversation, on your experience, what you had in Scotland, how will you
Yeah.
prepare, or what you will suggest your fellow clinician doctors, like your friends in the college, that how they should prepare themselves before going to any other scientific meeting, either national or international?
What I missed about my meeting was that always these kind of conferences have some hands-on goals. Like I think that's the best way to interact with the co-presentees or co-people who are coming, who are people, residents that are going to come to the conference. That's a very good way to start. Or nowadays, I am also connected via Instagram to some people, and I'm not regularly chatting with them, but I think I interacted maybe like once in 6 months with them. So that's a very good way for us to interact right now. Like I'm in contact with two people via Instagram, and I just had a little chat with them then. So I think instead of reading papers right now, we have more options, but reading paper is the best. Like you can read the papers, it's very easily available on the internet. It's very easy. You just have to go through them. It hardly takes 10 minutes. And that's the best way to start a conversation with someone who's very, very high up in the hierarchy from you.
Yeah, and this is a very well raised point, that whenever you are approaching an established professor, researcher, or a scientist, please don't write generic emails. Go through their work and be very precise when you are writing this email, because these professors, scientists are getting hundreds of them every day. So you have to be very crisp.
Yes.
Your When you're writing an email, your subject should not be just like seeking for this, looking for this. It has to be so appealing that they at least open it up. Because there are so many emails which make to trash without even getting opened up. And when,
Yeah.
as also Anu just mentioned, that if you read that paper, it will give you an idea that in the first place, why you are writing to this professor and what specifically you are seeking. It has to be very crystal clear so that the chances of getting a response from these professors are high. Now,
And best part about these things is like I went with 7 people and my professor there, but I was not looking for something more. Like two of the people who were already there, they got an internship or rather an observership for 14 days there. I wasn't even looking for that. I should have been looking for that. And
yes,
I should have interacted more with them. Maybe I would have gotten something too. So
yes.
that's what I miss about that's a missed opportunity for me.
Exactly. And this is like this goes back to my previous question, that now, based on your experience, when you are sharing your experiences from that trip, now to your peers, you can tell this, that, hey, try to look for these opportunities, which not many people are aware of. I have missed it.
Yeah.
Probably when next time you are traveling, you can take benefit out for these opportunities because anyways you are going there. If you can extend your
Yes.
stay and have these observation, because that's when you get hands-on in knowledge and information about different countries, their
Yeah.
culture.
One-to-one interaction.
Yes, that is very important. So, Anuj, at this, so now we are walking towards the edge of our conversation. I would like to know that in future, how you envision yourself as a clinician doing research and inspiring the next generation of researchers.
Right now, what I can envision is that I'm associated with a medical college or a hospital in India that's run by the government so that I can have ample data. And I'm publishing through the years. And as I grow older, the depth of my research is getting deeper and deeper. Like it's not superficial, right? Like the current research I'm on, I think it's very superficial and I want it to go much deeper and rarer.
Mhm.
That's what I want with my research portfolio.
So we see a hardcore researcher in you, and we wish you all the good luck for your future. We will say to all the audience that at Empowering Science Foundation, we believe in breaking the barrier, and one of the barrier is when you want to get an expert opinion, the guidance, and you are not finding it in your near vicinity. We are there to support you, having our researcher celebrities from vast different fields, various organizations, national and international. Dr. Anuj is now our researcher celebrity, is available for helping people seek if guidance for different, either it is about the opportunities or it is about the how he achieved what he has achieved, how he has walked his path. All of our researcher celebrities are there to help you, to support you. What all we want from you is the passion for research, the spirit for perseverance, because research is not something which is an overnight job. People have spent their lives for it, and still we know so little about either the humans or the insects or the disease or so many other different parts. So generations over generations, as in case of Dr. Anuj, his mother is a clinician trying to do research. He is a clinician committed to research for in a longer run. What is changing in India is like now everyone coming together, developing interdisciplinary research and thinking to work towards one health mission to make a world a better place to live. At the end, I would like to say thank you, Dr. Anuj, for sharing the journey, the passion, and motivating probably some of the clinicians who will listen to this conversation and now motivating them to pursue research for their future. And to the other audience, we'll say stay tuned for another episode of Researcher Celebrity. We are there to help you. And to Dr. Anuj, thank you so very much for taking time out
Thank
for
you.
this conversation.
The pleasure is all mine. Thank you.